An apple a day
Ooh.
keeps the doctor closer.
All
What
right,
on
tell me
earth
a
does that
bit more about
mean?
this one.
Okay, so big tech, we always talk about like the big sort of four or the big five, the FANG or the GAFA, whatever term you want to use. But actually, a lot happened in 2022. Apple actually did fade a tiny bit towards the very end of the year, but you can see that in November they were valued at more than the combined Meta, Amazon, and Google amount. And that's largely because Apple, of course, doesn't rely on advertising or simply pure B2C consumer retail, which of course is a huge part of Amazon. Amazon, by the way, has a huge advertising arm as well that most people aren't aware of. But yeah, that has created a real detachment between Apple and everybody else. And I think that Apple, the way that it's been focused obviously on its products, is actually very well poised to enter into a brand new market. And the thing about having such a huge share price, Noreen, is it's not just based on today's value. Share prices are obviously based on future value. And when you've got such a lofty value, you have to live up to it. You have to expand. And there is only one sector in the world that has the degree of margins and the degree of disruptive need that needs to enter it. So it's not a question of when Apple goes into healthcare, it's just a matter of how. And it absolutely is, in my opinion, going to become, like these other companies on the left, a health insurer going forward, at least in a small way. And I believe that it'll actually do this, obviously having its secret superpower of all of your health data and being able to understand, therefore, your prognosis going forward. But I also think it could employ a model a little bit like how Tesla has done when it comes to insurance. So Tesla obviously are cars that have a huge number of sensors in them, and they can actually judge how good a driver you are. So when Tesla brought out its insurance markets, of course, it was able to select which drivers and it should focus on, and it was able to offer better premiums to those who were judged as good drivers. Basically, all of the sensors combining to create a safety score, and that safety score then leading to reductions in premiums up to as much as 60% in some cases. So I think that Apple could take a very interesting similar approach. It actually did this with the credit card markets that it entered about 3 years ago. And I think that it could be really interesting to see how it could, probably in partnership with an existing health insurer to begin with, actually work its way into this market gradually.
They're going to have like health scores, like similar to how people have talked to the Black Mirror episode about like social credit scores. It's just going to be scores upon scores upon scores, which then dictate your premium.
Yes, that score may not be visible to you, as it isn't on some services either, but it is going to allow them to enter in a more nuanced manner.
Interesting. What does that mean for big markets like China or India, where the insurance system is just a bit different than
oh, well, yeah, this is very much applied to an American market only at the moment. Sorry, I should have made that very clear at the beginning. Obviously, yes, you are absolutely right. Perhaps improving itself in this new space, it can find itself, maybe not to Chinese markets, but certainly in European markets, I could see some progress being made. It doesn't necessarily have to become an insurer to replace the others. It can almost come as a layer on top of an existing insurance service. It doesn't have to even therefore apply to be an insurer in some cases if it's only going on that top level. And in many ways, it kind of already is. You pay out of your own pocket for health services from Apple right now, whether it be the wellness or devices like the Apple Watch, etc. So Apple is basically becoming more and more a service company. If you haven't realized, it's actually grown its service business from about 20 to 30% over the course of the last year as well. So absolutely driving that.